Thanks for joining me today for this episode of Early Motherhood. My name is Jocelyn Donovan. I am the CPNP for Niwasa Kandaswin Tag. Today, I'm going to talk about postpartum depression and anxiety. Now, this is a topic that is very near and dear to my heart because I did have postpartum depression and anxiety, especially with my first daughter, but also with my second. I decided to talk a bit more openly in this episode about what I went through, and I'm very nervous because this is on the internet. And I mean, theoretically, my daughters could watch this one day. And I thought a lot about that and about the things I'm going to say that I felt at the time. And I'm not ashamed of what I went through. Um, it's a really difficult time for a lot of people, and especially anyone who's had mental health problems before. But I decided I really wanted to talk about my personal experience because I want to destigmatize and normalize talking about mental health. And I think that the best way we can do that is by living our truth and telling honest stories about what we experienced. The transition to motherhood is not always as beautiful and idyllic as we may wish. I wish I could say that everyone feels peaceful and connected postpartum, but in reality, having a baby is a huge life change that can affect your emotional health. Now, there is a medical distinction between baby blues and postpartum depression and anxiety. So, the baby blues refer to the hormonal change that happens in your body in the 2 weeks after birth, which can cause you to suddenly burst into tears or into song. You might start crying because the shirt that you put on your baby is so cute. Most women experience some sort of baby blues, with about 4 out of 5 women reporting some hormonal behavior. Alternatively, postpartum depression and anxiety is much deeper and harder to deal with. There is a huge variety of symptoms associated with postpartum depression and anxiety. Some of them are manageable, and others are not. You may experience feelings of depression like numbness, emptiness, disconnection, irritability, and suicidal thoughts. You may think the baby is better off without you or that you're failing as a parent. You may also experience anxiety symptoms like obsessively worrying that something bad is going to happen to your baby, or that you'll do something wrong, or that someone will take your baby. You may feel scared to let baby out of your sight, or Google obsessively everything that could go wrong. You may experience physical symptoms like heart palpitations, trembling, sweating, trouble sleeping, stiffness, or feeling like you're suffocating and you can't breathe. Postpartum depression and anxiety can also cause psychotic thoughts and episodes like thinking the baby isn't yours. If you are experiencing any of these symptoms, please tell your doctor, your midwife, nurse practitioner, go to the emergency room in severe cases, but please seek help. In Brantford, the Pregnancy and Resource Center offers counseling and group sessions for women experiencing postpartum depression and anxiety. And you can always call me to chat about anything. I'm not a therapist or a counselor or anything like that, but I am a good listener and I have been through it myself, and I would love to help in any way I can. There are some risk factors for developing postpartum anxiety and depression. A family history of mental disorders or a personal history of mental health problems, adverse childhood experiences or ACEs, a stressful living situation, experiencing abuse, and a lack of support. So, my postpartum started while I was pregnant, which is common. My last month of pregnancy with my first daughter, I was in labor on and off for the month, which was very hard on me mentally and physically. And I started having weird thoughts. So I cried almost every day that month. I started thinking that my baby could hear my thoughts and that anything that I thought, baby would know. And so if I thought anything negative, baby would know that. I thought that baby could see my dreams and that if I had bad dreams, then it would be scaring my baby. I thought that I thought that I had so much poison inside me that my baby would come out wrong. I thought that she deserved so much love and that I wouldn't be able to give that to her and that I didn't deserve to be a mom. So, I didn't think I was gonna cry. And after my daughter was born, I didn't leave her side. It was painful to be away from her for a minute. I can honestly count on one hand the number of times that she was in a different room from me in the first 6 months of her life. Once I was in a grocery store and she was in a baby infant car seat in the cart, and I walked just a few steps away to get a bag of milk. And as I was coming back, I heard a woman say, "Hey, look, free baby." And I felt like my heart dropped to my toes, which is so silly because I'm sure that woman was joking, but I was terrified and I honestly thought that someone was going to take her. So when people asked if I had postpartum, I said no. I'm not depressed. I don't feel empty. I feel so more full of love than I've ever felt. So, but looking back, I really should have sought out counseling and therapy. I let myself suffer way more than I should have. About 20% of Canadian women experience postpartum depression. Unfortunately, there is less research on postpartum anxiety, which has been rising in recent years. Some info points to as much as 30% of women experiencing postpartum anxiety. There's also the most extreme mental health issue, postpartum psychosis, which affects about 0.1 of women post-birth. I actually had a friend who did develop postpartum psychosis after birthing a stillborn daughter. And she lost control of her body for about 24 hours until she could get to a hospital. That was a very traumatic experience for her and for her family. These conditions are not your fault. If you have any of these symptoms, seek help. There are so many people who want to help us succeed as parents. We really just have to reach out to these resources. I hope I helped explain postpartum depression and anxiety to everyone out there, and I hope that you don't experience these problems. But if you do, you do have a village. You have a community here in Brantford who wants to help. Please reach out to me. If I can't help, I'm going to get you in contact with resources and with people who can. Thank you so much for joining me today. Goodbye.